Okay, thank you. I'd like to call the special meeting of the Health Committee to order, October 21st, 2020. And we have all members present. We have no minutes to approve. Do we have any members of the public?
Chairman, we do not.
Thank you. So we'll move right on to departmental matters. Ms. Rodriguez, County Administrator, you have your budget items.
Thank you, Chairman Schaefer. Just before I read the action item under 4A1A, I will note to the membership that it does include two separate budgets, one to be presented by Mr. Jason Tabb, who is in the virtual room, and the other to be presented by Ms. Suzanne Scott. She is now the jail medical health authority that took the place of Ms. Shelley Welch. She is here in the room. I believe they both have PowerPoints, but I just wanted to forecast the order. I'll have Mr. Tabb go first and then Ms. Scott, but this will be one action item. Under 4A1A, I present this item for action. Request approval of Tort Judgment Fund 0135, Department 0077, fiscal year 2021. Recommended budget for Juvenile Detention Program 0022 and Risk Management Jail Correctional Health Services Program 0073, found on pages 3 through 7 of your packet.
Okay, can I have a motion? Motion by Chung, second by Martin. Jason, I guess you're going to go first then.
Good evening, everybody. I have a PowerPoint. If we can bring that up, we'll run through it pretty quickly.
Oh, yeah. We're getting it set up. I do believe this is one for jail medical, Jonathan. Right. I'm sorry. There you go. Thank you, Jonathan. And Jason, you just drive Mr. Fields to move on to whatever next slide, okay?
Okay, thank you. Next slide, please. I actually can't read that from here, but it's basically a version of our mission statement, what we're trying to accomplish with the residents we take care of here. I won't read that to you. Next slide, please. As many of you are aware, we're a 26-bed facility. We house males and females, ages 10 to 21. We are a short-term care facility. The average length of stay is probably currently around 12 days for kids. That takes into account any long-term kids or residents who are here for a longer duration, but the average comes out to about 12 to 13-day stay. We house kids for the 11th Judicial Circuit, and we do conduct business with a number of other counties that do not have detention facilities as the need arises. Next slide. It's one of our housing units for anyone who hasn't been here. Next slide, please. That is our medical department. It is a one-person medical department. We currently have a part-time nurse. There's a slide later on that we'll go ahead and touch on that now. She has put in her resignation. She will be leaving early December. So we have posted for a full-time or part-time, whichever we can get. Currently, population is low, so we are doing well with a part-time person, but we would definitely prefer to have a full-time person when possible. So she'll be leaving us here shortly in December. There is a decrease across all lines in spending for 2021. We took the recommended 4%, and in a number of areas, a larger amount was determined not to be needed. So we went ahead and reduced that as we saw fit in order to make things work. As I said, we're posted for a new RN and both full-time and part-time. So looking for one or the other. Upgrade, we were a pilot program for the Maisie 2 mental health assessment screening. We now have to purchase that program, and it's done via the internet. So we are working out the details to get 5 of our detention officers access to that system in order to do that upon intake for every kid coming in. As we move forward with this, we would like to have all 19 or 20 of our staff have the ability to do it, so it can be done at the point of contact when they come into facilities. Right now, we're going to select individuals who have differing days off, so there's almost always someone within a 24-hour period that can do that assessment, and that's going to be an annual cost of $750 for those 5 people. Hopefully in the future we can get more staff on that system and have access to it. They will not give a generic sign-on for detention officer. It has to be specific to a person for tracking purposes on their end, to make sure that we have the individuals doing it who we say are doing it. So next slide. Other capital improvement, new video system. They are still here working. They started October 5th. We are going to be adding roughly 24 to 30 new cameras with the 16 existing ones that we do have. We're making a number of upgrades to pretty much capture all the living areas in the facility where the kids are. This was driven mostly by the Prison Rape Elimination Act. For liability purposes, we have to protect our staff. We have to have everything covered. And the Department of Juvenile Justice, during their yearly visits, say we're extremely inadequately covered as far as having areas of interest captured on video. So the team again was out today. We're making those upgrades. We're hoping to be done the week of November 22nd. I'm hoping to be done way sooner than that, but that is their deadline for this project. And I don't know the final cost, but initially I was told it was going to be around $60,000. So it'll have all new system, all new monitors, all new everything. Just to look at one of the kids' rooms. This is from an old PowerPoint presentation we used years ago, but again, just kind of showing what the facility looks like on the inside. I'm more than happy to answer any questions. I can do that now, or you can contact me via email or phone. Like I said, overall with the budget, everything is on the decline as far as spending going into next year.
Thank you. How about if we if we have a question for Jason, we'll go ahead and do that. It's first, and then we'll go to the other presentation. Member Metzger.
You're live. Oh, you don't have to unmute.
Oh, I don't have to unmute.
Right, you're good.
Okay, I'm so sorry. Thank you for the PowerPoint. That was helpful. One thing you indicated that there would be 5 users for that new mental intake software or application, and it was for 5 people with $750. What is it per individual if you begin to add additional people? Because I'm just wondering, that isn't in your budget, I believe. Is that correct?
Correct. This came out after the original budget was presented. The cost break from this company is after 20 users, and it's a cost break of $100. So we would only need 20, and so there's really no cost break to us if we pursue this. We would have to pay full price.
So full price is $750
for 5. So we would need whatever 20.
So what's the additional cost per individual being added? I guess I just wanted to make sure that you have enough funding to bring those people on as you need to. And I know you're trying to figure it out by who's working.
Yeah, it would be about $3,000 to have everybody with the capability for the year.
Do you believe you should add that into your budget then?
At this point, I think we can do it with the 5 that we have right now, based on their schedules and the availability. I don't want to budget money or spend money that may not be utilized. There's no assigned people that do the intakes. Everyone's capable and could do an intake at any point. We're just going to be more mindful. We're also going to use our program coordinator, who is in the building 5 days a week and overlaps both shifts. He can catch those kids that don't have someone in the building at the time. That's our plan moving forward for right now.
Thank you.
Member Gordon.
Thank you, Madam Chairman. With reference to the upgrades that are costing, you said the estimate would be $60,000 to $65,000. Is that in the capital budget?
Yes, that is a capital improvement. That is not out of ours. Correct.
That's, I very quickly glanced at your budget, and that figure would have shown itself if it
Yeah,
was
that
there.
one would have jumped
I
out.
figured.
Yes.
Thank you. I figured that was what was going on. Madam Chairman, I do have a couple of other questions. They're not particularly major, so I'll defer if others want to ask other questions before I come back to mine.
Go ahead and ask.
Okay. There was a reference, Mr. Tab, to there was a comment just below budget line 773.0001. This was services. Just below non-contractual services, there was a series of, there were several budget lines, 5 budget lines, and there was a comment for biohazard. And I wasn't sure what that referred to.
Yeah, our medical waste biohazard, we have it picked up quarterly. I don't know the name of the company, but they come out quarterly to pick up our biohazard waste and dispose of it properly.
So that's not with reference to any particular budget line of yours.
That one, I believe, is in non-contractual services.
Oh, non-contractual, okay. Even though there's a 52% reduction in that line.
Yes. Yeah.
Okay.
The amount that they charge per quarter can be covered by the amount that's still in there.
Okay, as long as the needs met, especially on biohazard, that's really the reason I asked. A couple, 2 pages further in our budget worksheet report, the budget line 516.0516.0001 occasional seasonal. That one shows a 13% increase.
For the adult jail.
That's on the adult side.
Oh, I'm sorry.
Yeah, Jason's is only on 3 and 4.
Yep, okay, thank you. And in that case, I'm done for now. Thank you, Madam Chairman.
Okay, does anybody else have a question? I have one. When you were talking about the cameras and the lack of them, one of the things that the sheriff mentioned, I believe at his budget review, was that they're working on body cameras for their officers, that are out in the field. But he was he mentioned it, made a comment about getting body cameras for the correctional officers. Is that anything that you've considered, or is there any kind of best practice for that for juvenile facilities?
I would have to look at legislation. I don't think we can do audio recording. We could do video if there was a body cam, but I don't think we can record audio. But it's never been something I've considered, no.
Okay, thank you.
Mhm.
All right, any other questions for Jason? Okay, then we will move on to the next PowerPoint.
It was the first one you put up, Jonathan. Yep, right there.
I can't see it yet. Hold on.
We are opening up the camera, Member Schaefer at the podium so that Ms. Scott can be seen. And Jonathan is getting her PowerPoint set up for us. Okay. I can't, you can go ahead if you want to present your PowerPoint and say hello.
Hello. Okay.
And then just ask Jonathan to move the slides ahead as you wish.
Okay, next slide. For the Mclean County Health Services Department, the 2021 proposed budget has just a couple areas of decreases and increases that would be notable. Next slide. In line 60701, the food line, we're requesting that this line item be increased from $941 to $800. This line item is under budget, so suggested that it be decreased. Line 612-0001, books, videos, and publication. We're requesting that this line item be decreased from $376 to $250 due to the fact that we frequently use the internet and reference books are not used as often as before. 9715-0001, dues and memberships. Requesting that this line item be decreased from $415 to $200 due to only having 2 nurses who require annual CCHP membership. Renewal of certification is $100 per person. Line 0622-0005, vaccines and prescriptions. We're requesting that this line item be increased to $115,000 to reflect the increased cost of psychiatric medication ordered by our new psychiatric provider. We continue to see an increase in mentally ill patients that are coming into the facility. Examples of medications being used are Abilify Maintain injectable at a cost of $2,231.89 per injection. Invega Sustenna injectable is $2,806.60. Currently, we have 3 people that are using the Invega Sustenna with remarkable results. Increased compliance to us seems to be worth the added cost. Graybar tablets are $42 each, and Saffris are $10 per tablet. We do not currently have anyone taking Graybar or Saffris. HIV medications and asthma inhalers are expensive as well. And we've also noticed an increase in insulin cost. Line 0751-0001, for the medical director. We're not budgeting the correct amount in this line for several years, and that's resulted in a request for an increase from $87,846 to the actual amount of $92,769. We have no control over line number 0757-0001, non-employee medical expenses. It varies from year to year depending on the health of our patients and how many injuries occur and may require outside treatment, especially orthopedic. Thank you. Do you have any questions?
Thank you. Are there any questions from the committee? Member Gordon.
Thank you, Madam Chairman. I have a couple of questions relating to some items that Ms. Scott just referred to. I'll ask the question here that I tried to ask Jason Tabb, and I was ahead of myself. In budget line 0516.001, there's that's occasional seasonal employment. The request is for a 13% increase. Is that what's happening?
I can help if you would like me to, but Ms. Scott, if you prefer to answer.
Please help.
I can certainly help. And I'm hoping that while my staff was reminding me why we had the increase in this line, that this is what we are talking about. So we did find some formulation errors in last year's numbers. And so in the 2020 actuals, they're just, the calculation was off. And so we, in the 2020 budgeted, I'm sorry, in the 2020 budgeted. And so when staff went ahead and projected to what would really be needed for 2021, that's where we came up with the increase, Member Gordon.
Okay, so the figure of 2020 actual is lower than it actually was, or is.
I misspoke, and Ms. Dryer is in the room and could correct me. I do believe the actual is correct. The budgeted was incorrect. I should get out of the way and let the expert get to this one. Excuse me.
Ms.
I
Driver,
remember-
your hair color changed.
I like to keep you guessing. As Administrator Rodriguez stated, we did have some formula errors that we identified earlier in the budget process. So your 2020 actual amounts that are listed on these spreadsheets are correct. Those are your actual amounts as run on September 18th. We're talking about formula errors from adopted budgets from 2021 or from 2020. And so there a couple of things occurred in the 2021 budget as we were creating it. In addition to the formula error, we also identified that some of the staff that were included in the 503 full-time salary positions were actually part-time or seasonal occasional employees, and some of those shifts were made. And so we corrected for those in the 2021 budget.
Thank you. I think that explains it very well. I appreciate that. I had two other questions for Ms. Scott, if I may. From her presentation, I had noted one of these earlier, just going through. In budget line 0622.0005, vaccine prescription, non-prescription. Is a request for a 2% increase going to be adequate?
I think at this point, it will be. Looking at the months we have left in this year's budget, and projecting that out to how often she prescribes those shots on average, I think that it should be adequate to cover us for 2021.
Okay, thank you. Thank you. And the question that came up, just came to mind very quickly, has to do with the dues and memberships budget lines 0715.0001. Could you, it was in your PowerPoint, could you tell us again what the figure is proposed for 2021 in that line? Because I think the number you said in your presentation doesn't match what I have on my worksheet. And that it's not a very large amount in any case, but I just want to raise that.
Is that the $200 for the dues and memberships?
Yeah, dropping from 432 down to 200.
In the PowerPoint, I have 415 to 200 due to only having 2 nurses who require annual CCHP memberships. And that's a certified correctional healthcare professional. I'm one, and we have one more, and each renewal is $100. So we don't have anybody else other than that to renew. So that's why we have the decrease.
So George, I can explain that, Suzanne, if I may. So the reason that we have it left at 415 in your budget presentation for the 2021 county administrator line, and also in the department head, is after you know that Suzanne's predecessor, Shelley Welch, put together this PowerPoint as well as her budget at the same time, because she was leaving just a few days later and retiring. And so the adjustments that we made in her budget meeting, which included a conversation about these memberships and the fact that she was understaffed with her full-time nurses and RNs and may indeed need those certifications when she's fully staffed, we left that at $415. And I don't think that got reflected in the update, did not get reflected in her PowerPoint, and she created those at the same time. So my apologies for not catching that.
That's all right. But the final figure, the final accurate figure is 200 rather than 415.
The accurate figure is $415.
Oh, okay. Okay, it was the PowerPoint.
The PowerPoint that's incorrect, yes.
Okay, thank you. I just wanted to be sure which figure was correct. Appreciate the update. Thank you.
Anyone, Member Metzger?
And you probably can answer this also. Why was the medical director fee incorrect for so long? What was, because it's not a significant increase, but it is an increase. So what were we doing that we were able to find the error and correct it?
The error in the contract was actually brought to us by Shelley Welch when she was creating this
Oh,
budget.
okay.
And so I believe what it was is the contractual amount, in previous years when they were creating the budget, they just had not caught that the contractual amount had gone up.
Thank you. And the only other thing I think, Ms. Scott, not that it's an amount that is very significant, but the food, that's for staff, is that right?
No. The patients, it's usually peanut butter crackers. Okay, there's peanut butter crackers and orange juice for anybody that runs low when we check their blood sugars.
Okay,
That's
thank you.
generally what it is.
Okay, anybody else have any questions about either one of these budgets? And hearing none, Ms. Morlock, would you please call the roll?
You bet.
And the chairman will vote.
Thank you. Member Chung,
Yes.
Member Gordon,
Yes,
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes,
Chairman Schaefer.
Yes. Thank you both. Ms. Rodriguez.
Thank you, Chairman Schaefer. I will move on to item 4A, 1B. If it pleases you, Chairman Schaefer, I would intend to lump all of the sub-departments under B, which are items 1 through 8, into one action item and not consider a roll call on each. Is that okay with you? Good. So I will read this now. I am requesting approval of Nursing Home Fund 0401, Nursing Home Department 0090 for fiscal year 2021 recommended budget, including the Nursing Services Program 0080, Social Services Program 0081, Activities Program 0082, Dietary Program 0083, Laundry Program 0084, Domestic Services Program 0085, Plant Operations Maintenance Program 0086, and the General Administration Program 0087.
Can I have a motion? Motion by Metzger, second by Martin.
I'm going to, oh, I'm so sorry to interrupt you.
I'm sure we have a PowerPoint here.
We do, and I'm going to move away so Ms. Edens, our nursing home administrator, can have this seat, and we will assist as needed.
Okay, I got my voice back somewhat, so I'm not too squeaky. Okay, picture of our beautiful nursing home. Next slide. I'm gonna go through the PowerPoint, and then afterwards, if you wanna go line by line, we can do that as well. Okay, the reductions in our nursing department, had a 22% reduction in non-major equipment costs, and that was due to the fact we are doing better monitoring of our inventory. So we were able to reduce some costs there. Hiring qualified individuals resulted in a 14% reduction in temporary employment services. That's decreasing our agency, so we're working on that very diligently. Easier online learning and COVID are the reasons for the 17% reduction in schooling and conferences. We were also down 48% in books and videos for that same reason. It's just easier to go online anymore than it is to look at a book, and quicker. We are working with Veterans Administration on non-covered nursing expenses, which resulted in a 22% reduction. And that's for like VA equipment when needed. If we don't have it, we generally have to rent it. So we work with the VA closely if there is something that they would be willing to provide. And then just better systems of operations for offering office supplies or ordering office supplies resulted in a 48% reduction. So that we're just going through, like I said, just a different way of ordering. Not everybody's doing their own ordering. They have to go through the front office to do that. This is my social service crew. I just kind of wanted to go just to show you a picture. Julie has actually been with McLean County for 24 years. So I just wanted to recognize her. Dawn is the new assistant. The next people over there is our activity department. And Betty, the first gal, has been there for 20 years. The next one, Lydia, the director, has actually been there for 5 years. And Mika is our new assistant. So there's some longevity employees. Okay, the next slide is our reductions in social service and activity department. Again, just better systems of operations for ordering the office supplies. Reduced a small amount, 4% in social service, but a huge amount in activities at 58%. Next page is longevity, and I apologize, Betty is not her name, it's Debbie, and she's actually been there for 15 years. Shelby is the new director, and Mildred the cook has been there for 5 years. Food costs are expected to increase by at least 2%, they said, in 2021. However, with new methods of operation that we're doing, we do expect only a 1%, or we actually expect a 1% decrease in our budget. So we're offering different choices, which are a little bit cheaper, but still good. More home cooking, I should say. Purchasing non-major equipment for kitchen. When we looked at that, those are more on a capital expense. They're generally over $1,000. So we are saving 4% in small equipment purchases for dietary. Although COVID-19 does require us to use paper supplies for cautionary measures, that did increase our budget, unfortunately, by 74%. Next one is our laundry and housekeeping. Again, better inventory control. However, even with COVID, we did decrease our cleaning supplies by 18%. And I think that was due to the inventory control too. And non-major equipment is also down 20%. And that's just based on past historical trends. Excuse me. Plant operations and maintenance. These are what it did increase by 133%, and those are these are the 2021 projects that we have up and coming. We need, brick tuck pointing, that's projected at 40,000. Window replacements for like the next 5 years. Camera upgrades, chiller repair. You can see those are P-TECH units. Door alarm upgrades. However, their laundry and cleaning is going to be down 100% because we're not going to have uniform service. And the last one, reductions in general administration. Just efficiencies with management restructure resulted in a 24% reduction in salaries. We were able to combine a couple positions. Systematic changes and better systems of operation for ordering the office supplies again, down 22%. And letterhead and printed forms, lower costs and advantageous for us to do our own, actually saved us 48% in costs. And that is the end of my PowerPoint. So I'm sure you have questions.
Thank you. I need did I have a motion? Yeah, I have a motion. Okay. Anybody have any questions? Member Gordon.
Thank you, Madam Chairman. I'm going to be traveling through the budget worksheet in the order it was presented, and I'll take my questions, but I'll identify them carefully by budget line.
Okay.
In budget line 0516.0001, noticed a fairly substantial percentage increase in occasional seasonal employee, 63%. And that caught my attention. I was interested in knowing what lay behind that.
Well, what we did is the full and part-time, just a reorganization in part-time status. The dollars were absorbed in full-time and PRN staff, so we just moved it to a different area. Does that make sense? We're getting rid of part-time staff and doing more PRN and more full-time.
Good, thank you. I believe there was a mention of that in the PowerPoint. Not exactly that point, but something similar to it. Forgive me, Madam Chairman, I beg the indulgence of the committee. That may also answer a question. I had a question with budget line 0516.0001. That's also occasional seasonal under dietary. Is that there's again a fairly substantial increase, but is that also explainable along the lines of what you just said? 516.
Yes, Terry, those trends are the same.
Yeah, it is. It's all the departments, you'll see that same trend across all the departments. Yeah.
All right. And let me quickly turn through my pages, because if I have any other questions on that particular point, I won't ask them. You referred to the budget line 0744.0001, the 133% increase in maintenance, buildings, grounds, and equipment. Could you just briefly repeat what you had said?
Yes.
Thank you.
Those are going to be for name list.
There are also any comments. Do you have your comment?
Oh, I didn't put my comments. Oh. Okay.
It's 21.
Sorry. So there we go. Okay. All right. So that is based on the historical trend and potential upgrades to the building as parts of efforts to increase the census, as well as necessary mechanical upgrades. 20,000 is for brick repair. 50,000 is for chiller upgrades. 20,000 is for the camera upgrades. 6,000 is for the kitchen damper replacement. 1,200 is additional signage, and 10,000 is for the door alarm upgrades.
Okay, thank you. And I believe I had, no, I was going to say one more on the page I'm looking at. There are a couple more after that. You referred to the combining of some positions that resulted in a 24% reduction in the salaries line. Frankly, that's pretty impressive for any organization, especially one that's trying to do more in other directions. Will the needs be met? I guess that's my question, because that's a noticeable increase, a noticeable reduction rather, in salaries. But that was, you referred to that as in terms of efficiencies, which I'm sure it is. Is that 24% reduction still going to allow the nursing home to meet all the needs that you need met?
Absolutely. What we ended up doing is we took, we had 2 ADON positions. Really didn't need 2. So, I mean, I've never seen 2 in any other facility that size. So we looked at the job duties of each one and figured them out hourly, just how many hours we actually needed, and we're able to combine into one. So we didn't lay anyone off, but when the one person left, we just didn't refill that position. And it is efficient and they're doing well.
Okay. Thank you for that, Madam Chairman. I have no more questions. Appreciate it.
Anyone else have any questions? Member Metzger.
Uniform services, you said that you are no longer going to be using the uniform services, so you have a reduction in that. What was the replacement for that?
That was for, that's Aramark, and it was providing uniforms for maintenance, but we don't provide uniforms for the other departments, and they, so in order to make it fair, I talked, discussed with maintenance, and they're going to wear a polo type shirt and regular work pants, and they're okay with that. So
Okay.
Yeah.
All right. And the only other, I'm just curious how you reduced your activities budget by 58%.
Well, I'll tell you, the office supplies at every department was just outrageous when I got there, and so I just kind of monitored that for a couple months. And everybody was kind of ordering what they wanted, when they wanted, if they wanted. So I just told them that they just have to go to the front office, and my office person is in charge of it, and she hands out weekly an office needs list. They fill it out, they hand it back to her, she goes over it with me, we determine yes, if they need it, no, if they don't. And that's how we order it. So it just worked out a lot better than everybody ordering what they wanted.
Okay. Inventory control.
Absolutely, yeah.
Anyone else have any questions? I have two. The first one is kind of going back to what Member Gordon mentioned on page 8, and it's also kind of on page 15 on the seasonal, occasional, but the whole, to me, the whole total line, if you look at the budget from 2020, it's increasing by 3%, but you're only decreasing the temporary by 50,000, but you're increasing the overall. I'm trying to find this right line here. On the full-time salaries, is that right? When you add up these lines, that one isn't as bad as the other one I thought.
I can speak to that.
I guess it's kind of goofy the way not goofy, but for us non-accountants here to try to understand how that's being adjusted when you're looking at an increase that's
So
smaller than that.
Yeah, sure. I'd be happy to explain. There were a few factors that went into those changes in those numbers. And so we did move people from 515 part-time employees into the 516 line. We also have to adjust for minimum wage. And we do have employees in the nursing home that are close to minimum wage or making minimum wage. And so those adjustments were made. And then we did also factor in increases for our staff at the same rate that we did for other employees. So it was a 1% increase in January and a 1% increase in July. And so if you combine all of those changes in our FTE sheets, these are the formulas that you come up with.
Okay, thank you. And then my other question was on when you increased the paper products because of COVID, is that a reimbursable expense through any of our programs that we can apply for or that we're getting money for?
Through the CARE Act, it possibly could be, but when we did this, we didn't have that. So yes, we could possibly be reimbursed for some of that, yes.
Anyone else? If not, Ms. Morlock, can you call the roll?
Yes. Member Chung,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. And so that passes. And so Our next meeting is November 2nd. We have no bills. Any other comments? Any business or communication? If none, thank you all and